So let's open this case and have a look and see what's going on. So it's going to be quite a chest-heavy case, a lot of cases today. So having a look at this case, we've got, it looks like an X-ray of an adult patient, and it's very, very important to make sure you've had a good look at all the lines. So we can see that there's a line going down like so, all the way like so, and that looks like the NG tube is actually adequately placed. You've got your central line that goes all the way down like so as well, and that looks like it's adequately placed as well. So okay, lines look okay. I'm not particularly worried. Do they have an ET tube? Yeah, I think they do. So they look like they might have an ET tube which stops here, and you'd expect the bifurcation of the carina to be over here. So that's also adequately placed as well. If that ET tube had gone all the way down like so, then you'd be worried. Then you'd probably see some sort of collapse or some consolidation or hyperinflation, depending on what they're actually doing with the patient and that tube at that particular time. But on this patient, I think we don't see anything like that. I think all the tubes are adequately placed. We're not worried. But then with this patient, you can see the sort of kind of almost like net-like, thickening all the way through, right? All the way through both hemithoraces, no particular distribution, no perihilar distribution per se, and almost uniform across. Exactly, someone has said it correctly. At this point, I think, depending on the clinical history, but at the very least, you can say this is most likely to be in keeping with pulmonary edema. Now, when we go back to my little diagram, what you'll notice when you're looking at these, I've used the wrong pen, I've used the Apple pen. So when you're looking at CT scan from above, each kind of air cell looks like a little hexagon like this. And you've got this little dot for your blood vessel, and you've got a little dot for your airway as well. And so what can happen is that when you can actually get thickening of the surrounding hexagon, basically. And that's going to be as a result of a few things, right? So either it's going to be lots of fluid, it could be lymph that's done it. And it's not really going to be blood, but it can be lymph. And also then that's when you've got to look at it. Is it smooth thickening or is it kind of nodular thickening? So if it's nodular thickening, we get lots of nodules along there, then you're probably thinking along the lines of carcinomatosis, lymphangiomatosis, or you're thinking something along the sarcoidosis, because that causes a bit of lymphadenopathy as well. In this case, what I think we're seeing is sort of very smooth interlobular septal thickening. I know it can be difficult to see that or say that 100% on a CT scan, but generally speaking, it doesn't look like there's very much nodules anywhere. It doesn't, and when you look at that sort of interstitial, sort of that fissure over here, that doesn't look particularly nodular either. So I would actually go towards a cardiogenic failure, exactly like someone said, pulmonary interstitial edema, something along those lines, or ARDS, depending on the clinical history. Something that would actually favor something like ARDS is clearly the patient's quite unwell, very, very unwell, right? Heart doesn't look particularly large, so this is maybe something that's happened quite recently, quite quickly, in the middle of being generally unwell. So I think this is I thought was quite an interesting picture, just because I had that sort of very net-like appearance. So when I do a lot of the teaching for people, I often tell them, they'll throw in something like reticular, but I don't think they know what they're really saying when they're saying reticular. So reticular essentially means net-like. So if it looks like a net, you can say reticular. But then if you say reticular nodular, that's when you talk about those little tiny nodules that I was talking about earlier, where then you're going down very specific roles of, is it sarcoidosis? Is it basically cancer, underlying cancer within the lymph system? So yeah, that's hopefully a fairly interesting case.